I am the acting executive director of CASA. I always laugh when I say acting because I feel like somehow I need to be doing like a mime or something of whatever. I've just lost my marbles tonight. In any case, tonight we're doing a little Ask CASA. And Diane is with us again from the FACES Clinic and from the Encompass program. And I think probably about 20 other things that she does in her spare time. And she's brought two special guests with her this evening. So I'm going to let her introduce them.
Hi, everybody. Thank you so much for joining in. I'm really grateful, actually, that you guys are recording this. Some of you, pardon me, people like Jamie who've heard this before and know all about the FACES Clinic. But I feel whenever I'm in this space, I need to explain where I come from. So I come from a background of fostering, and I was very fortunate to be able to have a job where even though I'm no longer actively being a foster parent, I'm able to support the care of children that are coming through our clinic by supporting their caregivers. So my role is a trauma coach, and I work with foster parents that come through the FACES Clinic. And for those of you who aren't familiar with us, we are in the Benedict Building at UMass Memorial Hospital, or at the university campus. And I'm clearly biased, but I think that it's a really wonderful place for your kiddos to go and get care. And I know as CASA volunteers, and Caroline and Mothen, you might not be super familiar with what their role is, but they are advocates for the children in the court system. They are actually volunteers, which, considering the amazing work that they do, the dedication that they have, I mean, typically, and you can correct me, Lynn and Jamie, if I'm wrong, but typically they are assigned one case. So they don't have, a caseload of 20. They're really focused on this particular case, and they really advocate for what the child's wishes are in court. So they are the eyes and the ears for the judges. With that, I think it's really important for them to know that the FACES Clinic has a lot of things here that we can offer kids that come into care. We were set up for 7-day and 30-day medical screenings so that kids could get their immediate medical attentions, needs met. However, we have expanded to also include things like some gap psychiatry so that they can get linked with a Medi-Val with a psychiatrist, because we know that there are a lot of kids that come into care that have maybe outdated prescriptions or prescriptions that don't quite fit, or undiagnosed things or overdiagnosed things. So we really try to take a fresh look at those kids when they come in for their medical and mental health needs, and link them also potentially with GAP clinical services. So getting them some trauma-informed therapy potentially. Along with that, we work with some wonderful medical students, two of which that I, roped into working with me and coming here tonight to talk about a project that they've been working on, which is near and dear to my heart because it's about youth mobile crisis. And I'm going to let them explain what they've been up to and what they've been doing, and how you guys can help families use youth mobile crisis properly in our really strained mental health world. So without further ado, I'm going to let Caroline and Mothen introduce themselves and give this presentation. If you have any further follow-up questions about FACES or about youth mobile crisis, the folks at CASA have our connections, and we're always more than willing to help wherever we can and explain the services better to you. I do plan to come back and talk again about some of those things that we identified the last time I spoke as interests and needs that you have. So I haven't forgotten you, and I'm certainly willing to take in more feedback on what you would like me to speak about in future sessions. But for now, Caroline and Mothen, I'm going to let you guys take over.
All right, well, good evening, everyone. It's nice to meet you all. My name is Mothen. I'm a third-year medical student at the University of Massachusetts.
I'm Caroline. I'm also a third-year medical student at UMass.
And today we're going to talk to you a little bit about the Youth Mobile Crisis and kind of what it is and how it works. So this talk we initially gave a couple weeks ago, and it was kind of to an audience of foster caregivers. So this is kind of from their perspective of what they should kind of know.
And I will share our slides, sorry. 1 sec. All right.
Right. So Youth Mobile Crisis Intervention, you're going to see it abbreviated as YMCI kind of throughout the presentation. So if you're wondering what YMCI stands for, that's what it is. And what foster caregivers should know. And then there's all of our names. So just before we get started, some opening questions we always have for our audience is, what words or thoughts come to your mind when you think about things like YMCI? Has anyone had any experience with YMCI in the group here?
No, I haven't. That's why I'm interested in learning more so that we can help spread the word more and use the services.
I would say that I've had a little bit, but not personal, right? Through our volunteers, when there's been a situation when they've been present with one of the children or a child on a case, and where they've been present when Mobile Youth Crisis has been called. So not present, right? But sometimes on the phone.
Awesome.
Yeah. And then one thing, Caroline and I and Cara, who's the other medical student, we're always open to feedback. So we'd always love to know what questions you're hoping this presentation can answer. And at the end, if you feel like your questions weren't answered, like, please let us know, because we're always open to changing our presentation and adding or subtracting things as needed.
Great.
All right. So, Youth Mobile Crisis, kind of what we talked about. What is it? We abbreviate it as YMCI. That's how we abbreviate it or refer to it in the Worcester region of the state. Different parts of the state will refer to this as different things because as we'll talk, different parts of the state have different emergency service providers. Also, sorry, can people hear me with my mask? I just have to wear it with the room I'm in. So essentially it's a free mobile resource where a youth who is aged from birth to 21 years old, who's having a mental health crisis, can have a team respond to whatever location they're in. Generally, it is children who are on Mass Health. So that applies to almost every child who's in foster care. However, it is also possible for children with commercial insurance to qualify for this. I unfortunately don't know the exact specifics on that, but I do know it's possible. So that's something, if people have interest in, we can explore later too. And the goal is essentially to, limit emergency room visits. As I'm sure you're all well aware, there's been like several studies over COVID too, showing that nationwide, the proportion of pediatric emergency room visits for mental health reasons has grown a lot. And a lot of children are boarding in emergency rooms, which means that they essentially hang out in the emergency room for days on end, waiting for a pediatric psych bed placement, which I'm sure we all know too, are very difficult to come by. So we've noticed that in talking with foster caregivers, reducing as many children going to the ED as we can is usually a good thing. And it's also providing a service to the youth and hopefully what's a familiar location, which can also be more therapeutic than, a strange emergency room with beeping machines and things like that. And this can be at school, home, after school program, residential program. It can really be wherever the youth is located, as long as it's like a safe location. And the team of the Youth Mobile Crisis Intervention group who will show up is usually 2 individuals. It's generally a master's trained clinician. So it may be a social worker, a master's level psychologist or other mental health worker, and then someone who's known as a family partner. So someone who may not be master's level, but is trained in working with families with, complex mental health type issues going around. And the services will generally have a child psychiatrist or psychiatric NP on call, should there be any need for necessary phone consult. And the service is supposed to be available 24/7 and 365 days. And we actually have here, if you have your phone and you're able to see the QR code here, we have this just if anyone's interested in scanning it to save and bookmark the YMCI website. So it's easy for you to access. So I can pause for a second to let people do that if they want.
Yeah, while you're pausing, Caroline, I just wanted to say that I have used Youth Mobile Crisis in the past, and as a foster parent, I think I used it really incorrectly. And I just wanted to throw that out there that it threw me off because the term was crisis. So I didn't really understand. I really thought that as a foster parent that they were just coming to take my kid. If I called Youth Mobile Crisis, it would mean that I'm in a crisis, and it was like very similar to calling 911. And I know you're going to get to that later, but I just wanted the volunteers on this call to hear that I don't think I was unique in misusing the service.
No, that's a really good point, Diane. Thank you for bringing that up.
That is a good point. I bet a lot of, I guess I can't speak to the foster parents, right? But I bet a lot of our volunteer advocates, when they see that or hear about it, would really think the same thing.
Mm-hmm. Yeah, and I
You know,
think
that it
actually,
has to reach a certain level, right? Before you should make that
Yeah.
phone call.
And that's
Yeah.
actually something we kind of touch on a little bit later in the presentation.
Okay.
It's like, when is a
Okay.
good time to call Youth Mobile Crisis?
Okay, great.
So in terms of services that YMCI actually provides, the first one is creating or updating a risk management or safety plan. And what that actually entails and means, we're going to explain in a little bit. But kind of the summary of all these interventions is to de-escalate the current situation and make sure that the child is in a stable situation and a stable sense of mental health. And connecting the child and the parent with resources and services in the community, whether that's reconnecting them or connecting them for the first time. And this kind of happens in two ways. It happens in the initial meeting, and then there's also a 7-day meeting after the initial call where they reconnect with the child to make sure that services are appropriately referred to and they're connected, and also that the foster caregiver is taken care of as well.
so here again, we just have the statewide number and the Worcester number. And the reason we have that is because anyone can call the statewide number and they'll be directed to their area provider for YMCI services. So we have the Worcester area provider number listed, Worcester services, which again, we focus on Worcester because that's where UMass is located and where a lot of our foster caregivers we work with in the FACES clinic are through. But the Worcester service provider for YMCI is Community Health Link. So this is just the number they use for triaging calls for them. And the statewide number is always an option. If people only save one number, we say save the statewide one and you'll get channeled through to the correct place.
So some frequently asked questions, kind of like we were just talking about, like when is a good time to call? So per YMCI, a good time to call is like when the child demonstrates changes in their mood, thought, or behavior that seems to interfere with their functioning at school or home in the community. And it seems to exceed the demand of the parents' ability to cope with that situation. But it's important to emphasize to all parents that it's better to call before it's too dire, and that it's okay to call before situation becomes too serious. Because oftentimes when physical safety becomes an issue, it can often be too little too late. And the point is to address the root cause of all of this. So calling earlier is much better than calling later. And then in terms of how long does it actually take for them to respond to a call, the ideal goal is within an hour. As I'm sure you're all aware, our current mental health situation is not the greatest. So there might be a delay in getting back to you, but ideally within 2 hours, you should get a response back. And I kind of touched on this a little bit earlier, but what exactly is a safety plan? It's an agent that YMCI uses to help the parent and youth develop a plan in case something like this happens in the future. essentially, the plan can include contacts for people who will be most helpful in a crisis, emergency contacts, really identifying things that kind of trigger the child. How do they act when they're in crisis? What are things people can do to help me when the child is in crisis? And then an important part is identifying goals of the plan. Like, what would be defined as a success? What does a parent like want to accomplish? And identifying what has worked in the past and what may work in certain situations moving forward. So really, it's like a planning tool in the event that something like this were to happen again.
And one thing that's kind of interesting with the safety plans is YMCI is actually supposed to keep them on file for a child. So if, if a foster parent is, happening to have a child come into their home who's new to them, and YMCI were to be called, there's a good chance that they could already have a safety plan on file for that child and be able to help the foster parent or caregiver build on that, and provide them sort of with that basis or understanding were they to be called to the home as well. And one other thing too, what Madan mentioned about sort of early alerts for children experiencing kind of the beginnings of what might be a behavioral health issue. So essentially they can call YMCI and YMCI will give, kind of basic guidance over the phone and sort of help triage the situation and maybe make a plan for the family when they can make a non-urgent response. We did speak with sort of a liaison between DCF and mental health services who did mention to us that sometimes parents will call YMCI or caregivers will call on YMCI and they will tell the caregiver, okay, we're going to make a non-urgent response and just provide guidance over the phone rather than triaging that call into needing an urgent response. So that's also something we just want to prepare caregivers for the chance that could happen. They may think, okay, this is something that needs to be responded to right away, but it's possible after speaking with them, YMCI will kind of help give them some initial guidance and then say, why don't we actually come a little bit later on? So that's just something we like to prepare people for the possibility of. Yeah, and this is just kind of a flow chart we made to sort of help with understanding the kind of flow of events after someone makes a call to youth mobile crisis. So essentially on the left side, the big sort of important note here is that if someone is, if the child or someone in the house is experiencing an immediate medical need, so that means they're having a medical emergency, or the caregiver believes that there is like imminent physical harm to the youth or others around them, it's best to call 911. However, if the caregiver is not sure of the level of imminent risk, YMCI triage staff are trained to help the caller determine if there's immediate medical need, and they can help send emergency services while they're on the phone with the caregiver if need be as well. And in some areas of the state, emergency services and YMCI can respond together in tandem to calls. So I know I did my psychiatry rotation on the Cape. In the Cape, that happens all the time. Madan and I are trying to still work to see how frequently that happens in Worcester. But then on the right side of the column, so if no immediate medical need, YMCA can be called and they'll be transferred to the area provider for the area that they're in. They'll speak with a triage member on the YMCA phone line, and they'll arrive at the predetermined location or via telehealth in COVID times. And they can also, if the child has a safe ride to the local area's office or headquarters, they can also arrange to have a meeting at the YMCI headquarters for that area too. Kind of just depends on the situation of the child and COVID things as well. And again, like Madan talked about, they'll work on child and family focused interventions, as well as crisis planning and safety planning tools. And then after this initial intervention has been made in the home or wherever the youth is located, YMCI will provide 7-day follow-up assistance, which will kind of form in the way of follow-up phone calls, helping if they can bridge or connect the family to resources in the community, whether that be behavioral health resources or other types that they could benefit from.
Carolyn, I'm going to interrupt you again, just because this slide was such an eye-opener for me the first time I saw it. I was like, you've got to be kidding me that they're actually going to call me 7 days later and see if I'm doing okay. Because as a foster parent, I had many kids that I unfortunately had to spend time in emergency rooms with because they had in some way been determined that they were suicidal. So I'm sitting there for hours and hours and hours and hours. And by the time we finally get seen, the kid's like, I just want to go home. And then we go home and nothing happens after. So the fact that there was a plan here and that somebody is going to follow up, for me as a caregiver, feels so reassuring. The fact that they keep their safety plans on file and that I get some information, which we all know can be very challenging to get information. I am very grateful to Caroline, Mothen, and Kara, who's not on this call. These med students have made a big difference in the way that I recommend people get help as a foster parent. And I hope that you do share this, Lynn and Jamie, with all the people that you work with, because I think that this is a vastly underutilized resource. I'm going to stop there and get off my soapbox and let them finish.
All right. Any questions on this slide at all, or? We'll keep going. Oh,
I'm sorry. I have a question, although I think it's sort of along the lines. Is there, I'm given what's currently happening, and I know that obviously mental health clinicians are short-staffed everywhere. Is there, or do you anticipate a possibility that, and pardon me if you said this, that there could be a Zoom interaction if you couldn't, get somebody out there in a adequate amount of time?
Yep. So telehealth and Zoom are actually one of the options that are offered. So that's definitely a possibility. Yeah, that's a great question.
Okay.
All right. I'll head over.
So what actually happens during a first meeting? So I've actually I've had the opportunity to participate at YMCI in a couple different interventions myself. So usually it kind of works. So the staff member that Caroline kind of explained earlier with the master's level provider, they typically meet with the youth and family members if possible, and they try to gather as much information about the current crisis and about what the youth and family have already tried. And this part can be a little bit hard, especially for foster caregivers, is knowing a lot about the youth's health and past medical history, medications, school, trauma, substance use history, treatment history, because oftentimes that information is not readily available to a foster caregiver as it might be for another parent. But they do their best to gather as much as they can. And usually this requires the guardian's consent, but they're able to speak with other providers, family members, and community members. And the idea of the first meeting is essentially to stabilize the crisis, relieve symptoms, mitigate risk, and kind of diminish the need for higher levels of care, like inpatient hospitalization.
All right. So foster care specifics on YMCI. So Diane really touched on this nicely, sort of at the beginning of the talk. So, some things that could, just maybe trigger a behavioral health crisis specific to a youth who's in foster care. So during COVID, this good example, restricted visits with biofamily, or increase in visits with biofamily that may be destabilizing for them. Having a new placement or having been recently through many different placements. These are all kind of things that it may be good if you're working with foster caregivers to say, hey, if you're seeing this happen, or your youth has been experiencing this in the past, maybe think about making an early alert to YMCI, especially if you know that they have mental health history, or if you're just kind of noticing they've been through a particularly tough time recently. Another important foster care specific, or not even foster care specific, but just something that YMCI told us happens a lot, is people will call if the child has run away, which they unfortunately can't help with. They do need you to call the police if a youth has run away from placement or home. Then there are always questions specific to foster care regarding the issue of guardian consent for intervention. So we spoke with one of the director of mental health services with DCF, Mother and I, and what she told us is that sometimes foster parents will call, or foster caregivers will call YMCI and be told, oh, well, you're not the official guardian. I can't, come respond to this if that's the case. And that's not true. So we want to sort of foster caregivers to advocate for themselves and know that they can be the one to request an intervention or visit for YMCI. So that was something specifically, this member of DCF actually told us to emphasize, is that foster care parents can initiate the visit, and they do not need to call permission for DCF first. So that's just another big point. Then obviously, like Mother just touched upon, unknowns about the child's mental health and medical history might make people a little uneasy to call YMCI, or they might feel a little bad if YMCI comes and they're asking all these questions that they don't know, and just kind of emphasizing that that's okay. You should still call, and YMCI can kind of help you work through those gaps in your knowledge about the youth. And then just knowing that when you're calling for YMCI, it's being used as an intervention at that point in time. It's not going to be, okay, this child needs to go to an inpatient facility, and the only way I can get them there is by calling YMCI. It's really for YMCI to come to the youth and make that decision themselves. Oh, does this person need to go to a higher level of care, or are we able to help stabilize them here? So that's just another note to keep going on.
So in terms of common misconceptions, and these are a little bit more foster caregiver specifics. So as a foster caregiver, I could get in trouble with DCF for calling YMCI for my child. That's actually mostly wrong. Oftentimes it's DCF workers who are often the people who recommend caregivers call YMCI for the child. And this is something that we've heard often from foster caregivers specifically, is that they feel afraid to call YMCI, and there's a portrayal that they may be seen as bad like parents or bad foster parents for their child if they were to call. And that's something that Caroline, Cara, and I are kind of working with Diane and others in the Faces Clinic to kind of get this message out there, that please call YMCI. Like, this is the reason that they exist, and DCF should be working with you to resolve these crises and not work against you.
I think it's even scarier for kinship placements. And I know that we are having an extremely high number of kinship placements now. And so a kinship provider might feel that they're not competent, and that people will perceive them as not competent, or that see the kids doing poorly in that home, and I know that they should be removed from that home. And that's not at all. It actually is a measure that they're taking the right steps. So I think that message needs to get out to families, that never should it be seen as a threat.
Absolutely.
So kind of just another misconception, that YMCI will remove a child from the home or automatically place them in inpatient treatment, like we kind of touched on. That's not the case. They'll work with the child to stabilize them, and try to help connect with community resources for outpatient treatment if possible. They can obviously recommend that a child go to the ED or have them transported there, but they will not be, removing them from the home arbitrarily or permanently by any means.
Now, how does COVID play into all of this? As we all know, it's been kind of a tough couple years with regards to mental health, and the COVID pandemic has often exacerbated a lot of the underlying issues that we've had in our mental health care. So this is just some data we got from Massachusetts Public Health. So nearly a quarter of Massachusetts children who received psychotherapy discontinued care over COVID-19, which is a substantial portion of children. And actually, despite an increase in the demand for services, the usage of YMCI declined, despite it being even more necessary. And so school times are generally when YMCI is used, and since schools were closed over 2020, they saw a decrease in the rate of utilization, despite the fact that children were still experiencing mental health crises. And so hopefully the more children who use YMCI, the more crisis management guidelines will become clearer. And our goal, and our goal as medical students and working with Diane and the FACES Clinic again is to make these guidelines as clear and available as possible so that parents, foster caregiver parents, and not foster caregivers have easy access to resources like this and know when and how to use resources.
All right, so we'd love to hear any thoughts that or questions that you have now after hearing the presentation, or if you want to share one of, a question about a previous experience you had with YMCI, and just also other resources and materials that you feel would be helpful for you all as CASA volunteers just regarding YMCI as a program.
I had a question, I don't think it was mentioned, as to when did the Youth Mobile Crisis, when did these services become available? When was this started?
That is a great question. I actually don't know if I know the answer.
That's okay, yeah.
It is offered, so which you all probably are aware, it's offered through Mass Health, and it's part of the Children's Behavioral Health Initiative. So I don't, but CBHI I don't think has been around very long, correct? Anyone aware? But I know it's through Mass Health and also partially through Mass DPH. So that's a great question.
Yeah, Jamie, thanks for asking that, because I think that a little history of where we've been is something that the med school students could kind of dive into a little bit and elongate this program. We were so anxious to get the information out to use the service. And we're in the middle of this COVID crisis, and we know that kids need services. We're like, here's the number, use it, please. And so my instructions to them were just keep it simple. Keep it very simple, very basic. Here's the number.
It was great.
They're gonna have a plan in place for you. Don't be afraid to use it. But honestly, having some framing around how this came about, thank you for that input.
Yeah, just a little. I thought it was a great presentation. And I would like a little more information about which commercial insurances are covered as well. I thought of somebody today that I might be able to recommend it to, and I just kind of Googled YMCI to see, and it popped right up that you had to be on Mass Health, and that eliminated the person I had been thinking of. And so but maybe there's some exceptions to that I didn't know about.
Yeah, that's actually really great to know, because that's something we've been meaning to kind of figure out ourselves. So we can definitely look that up and try to get back to you on it.
Will we get slides with this contact information so we have it?
Yep, absolutely. We can send along the slides.
Okay, that'd be great.
That would be great. And I guess the only other thing that I would add is, and I think Diane knows this because we've talked about it, but honestly, any resources that you can provide to us that we in turn can provide to foster parents. I'm sure, as you know, the children that we deal with are also obviously involved in the court system. And right now there's such a backlog in the courts that kids are staying in foster care longer. And especially, well, it certainly was a problem prior to COVID, right? COVID has just exacerbated the need for support for foster parents. And although it's not really our role, I think that more and more it's becoming our role, because obviously we're advocating for the best interests of children. And sometimes, right, that's advocating for what's helpful to foster parents. So I would just say any and all resources that you think would be helpful to foster parents, we would be happy to disseminate to them.
Yeah, we'd be more than happy to share the documents and things that we've made so far and things we'll
Great.
continue to make.
Great. Thank
Yeah,
you.
if Caroline and Modin, if you can send them along, that would be wonderful, because they made like a flyer essentially that we could use here at the clinic, and we also have a link on our FACES website as well. But I think having it directly in your hands to put out to your people would be wonderful.
Mhm.
And one thing, I'm not sure if this is helpful context, but just kind of along with Jamie's question about how YMCA started. I thought it was helpful to know, so just the different names of YMCI providers in different areas of the state. So in Boston, YMCI, so the youth portion of mobile crisis intervention, is called the BEST team, BEST. So most of the Boston teams that go through are under that name. And then on the Cape, Cape Cod, it's actually through a human services organization called Bay Cove. So Bay Cove is the company that kind of organizes all the dispatches and calls, and they actually help sort of triage cases in the ED, in the emergency room at Cape Cod Hospital, and even see cases there that come in through YMCI calls. And then, like we said, in Worcester, they just call themselves YMCI, but the provider that facilitates it is the Community Health Link organization, if anyone's familiar with that.
Yeah, it would be good if we could do away with all the initials, right? I was having a conversation with somebody the other day, right? I've been doing this a long time and they kept using initials. And I finally said, I don't have any idea what you're talking about. And he said, it's wraparound services, Lynn. I said, oh, I said, okay, that I get, right? I mean, it was just, but I do think it can become confusing as to like physical locations for some of these places, right? When you're using initials, I think sometimes a geographical reference is helpful to people when they're trying to drill down on what actually would happen when they make a phone call like that, or what could actually happen, or where would that child go? And clearly it's, you know, geography dependent, but I think that's also a fear of some of our foster parents, is that if in fact the situation required a child being transported, where actually would they be going? And we had a case not too long ago with a foster mom who ended up calling 911 because the child was self-harming. And she said that DCF was a little bit upset with her because they really wanted her to call some intermediary provider that she had dealt with previously, but she couldn't get a hold of them. And I think she certainly would have called Youth Mobile Crisis, right, if she had that information.
That's good to know. That's an unfortunate story or something
Right,
that
right.
maybe would have been helpful.
Yeah. So we'll make sure to get that information out. Does anybody else have any other questions? Guess not.
Well, thank you all for letting Caroline and I speak and present to you guys about YMCI.
Thank you. Thank you for taking the
you.
time
Yeah, thank you
Instead
very
of-
much.
instead of doing turkey prep, right?
Thank you.
And I don't know if you have any way of knowing how many people watched the recording, and Carolyn and Mother have been extremely humble, but they actually have presented this work that they've done on a national platform. So I don't know, Caroline, if you want to, and Melvin, if you want to brag about that a little bit, because this is something that kind of came out of a crisis that we're having here at the clinic. We're like, listen, we have an emergency department that's flooded with people, and we're not using services properly, and we're not alone in the state in using our resources that are so, you know, so limited in a non-trauma informed way. We have to make sure that the people who really, really need the care are able to get it. So Mother and Caroline, if you wanted to speak a little bit about the presentation you did, we have a couple of minutes here, and I would like you to have the space to brag about the wonderful work you did.
Yeah, we can. So we just presented like a virtual poster to the American Academy of Pediatrics conference this fall, which they are kind of, our hope was just to get almost like feedback and like kind of send out a consensus to other pediatricians who work with children in foster care about whether they have, you know, YMCI services in their state and what their experience has been specifically with children in foster care. And we got a lot of great feedback. We told them kind of about the handouts that we had made to educate foster caregivers on why they should call YMCI, when to, and how to do it. And also, the different kind of types of media we made, just, things on our website and, physical handouts. But one of the interesting pieces of feedback that we got was really trying to integrate or further integrate YMCI and local emergency services, and hoping that, eventually, as happens in some parts of the state, YMCI responds in tandem with emergency services so that it's not just, police responding by themselves, where a provider from YMCI probably has a little bit of a better de-escalation background than a police officer would. So I don't know, Mother, if you.
That's wonderful. That's wonderful.
Yeah, and to kind of touch on that a little bit more. So once we did that presentation, we actually have now started working with DCF directly a little bit. We met with the director of mental health at DCF a couple weeks ago at this point, regarding our project and kind of next steps, and hopefully making sure that all providers and doctors are aware of this service, that it exists, and educating the caregivers and the children about accessing the service and how to properly use it.
That's great. I'm wondering if we can, do you have any objection if we put this on either our website or our Facebook page? And direct people there, or is
Both
that
sides?
something? Yeah,
I have no problem with that.
I think that would be fine.
No, I have no problem with that either.
Yeah.
okay,
Nice.
wonderful.
I have another question, and again, maybe you covered it, I hope I didn't miss it, but the ages, is it up to age 18 or is it 21?
So it's from birth to age 21.
Birth to 21. And have you guys, this made me think about like pediatric, I'm a SANE nurse as well, but not a pediatric, so sexual assault nurse examiner. And I was thinking like children's advocacy centers, are they aware of these resources, or maybe having a flyer in the pediatric sexual assault kit that goes home with the patient may be a good way to use the youth mobile crisis as well. It's an idea.
Yeah, thank you.
So, yeah. Because I'm always looking for resources for, I think that would be great for families. Yeah, thank you, guys.
That's awesome. Thank you.
Thank you.
Okay, well, if nobody else has any questions, then I guess we'll wish everyone a wonderful holiday. I hope you medical students get some rest. Get to enjoy
you.
some time off. And Diane, and all of us, right? But
all in
yes,
it.
I do. I thank everybody for taking the time tonight to come out. And I will keep you posted on how many people we send this out to, or if we can track views or things like that, wherever we might post it, we'll certainly let you know that as well.
Yeah.
That'd be great. Thank you
Thank
so
you
much.
very much.
everyone.
Bye,
Thanks,
everyone.
everybody.
Enjoy
Hi,
the
Have a
holiday.
great Thanksgiving.
happy
Happy
holidays.
Happy
Thanksgiving.